Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. On March 11th, the World Health Organization gave COVID-19 pandemic status because of the number of cases and the spread of the virus. According to the Apex Health body, the number of cases outside China has increased 13-fold, and the number of countries the virus has spread into has gone up 3-fold in the last 2 weeks. So far, from the start of the scourge, more than 142,000 people have been infected in over 120 countries, with more than 5,300 deaths, and over 66,000 people have recovered. Europe is now considered the epicenter of the pandemic, with more cases than everywhere else combined except China. In Nigeria, all known contacts to the index case have tested negative to the virus and have been discharged. My guest is a consultant public health physician, executive secretary of the Nigerian Academy of Science, and past chairman of the Association of Public Health Physicians of Nigeria, Dr. Doyin Odubanjo. You're welcome to the show.
Thank you very much.
It's now pandemic, or it's now a pandemic. It can be used that way. Do you think this pronouncement was made soon enough? Was it too late, or does it matter at all?
I think it's a tag. It's just a tag, really, functionally speaking. Ultimately, the avoidance, or should I call it the reluctance to quickly use the term. Mind you, other countries were already using the term.
They
before
were?
the WHO, yes. Some of the health officials were already calling it a pandemic. But the WHO was probably reluctant to do so, probably to reduce panic.
Okay.
Because the moment you do, people's minds go to previous pandemics, and people get even more scared, and you get more erratic behavior.
Okay. Now, they say the cycle of transmission has been broken in Nigeria. All the contacts of the index case, they're negative. Right. In fact, the index case, it looks like it's going to be discharged soon. Now, based on our preparations, should we be dancing now, or can we be surprised with cases?
Absolutely. The problem with this is that the world now is a global village. So nobody goes to bed, not even China, until the whole world goes to bed. So China, as of yesterday or 2 days ago, sent a medical team to Italy.
Okay.
Because nobody can sleep easy until we all can say this is over. You know, we have now in our neighboring countries, we have Togo, Ghana declaring cases.
Kenya.
It means
Burkina Faso.
Yes, their capability to contain it in those countries is going to mean a lot for us. No matter what we do, and we do well, if they don't do their own bit well, for instance, we will be in trouble.
So in other words, everybody should be his brother's keeper in this matter.
Absolutely. And I think the WHO also made that point, to say countries with weaker health systems will need to be helped.
Okay, China is down to single digits. You know, they're having, was it 2 days ago they had 8 cases, which is so good compared to what was happening in China before. Right. Now, one of their experts was saying that if the world follows the Chinese example, we should be out of this thing by June. And I'm like, June? Isn't that too far? What do you think about this?
You know, when you say, for instance, we had an index case in Nigeria. That index case, we had so many contacts, you know, about 79 or something. It took 2 weeks to say these people are fine, which means that until you get the last case in the world, so to speak, to say this person has been cleared of the virus, and then all of his contacts will also have to have been declared okay. That's when you say it's over. And then you wait a little period also to ensure that there is no spontaneous case you were not expecting. So June is not too far. We're already in April, more or less, if you look at this properly. So June is not too far. With over 100,000 cases, we're not.
This is not a game.
No. And you also look at certain countries. What you have there are cases on the rise, not falling. Meaning
in
that
Europe,
this is just an epidemic that's just picking up steam.
Meanwhile, China is saying they've reached their peak and they're coming down. You know, I thought that once China starts to come down, oh, good for everybody, you know.
Well, unfortunately, China even shut down its 10 or so emergency hospitals that it built in a few days. You know, they're all closed down. So China is fine, but unfortunately, somebody took the baton. You know, Europe collected it from China and has to battle with it.
They seem to still be running with it.
They're still running with it. So until that is over, and then we hope everybody else contains whatever they are dealing with, then we'll all be fine.
Okay, Nigeria said, you know, they sequenced the genome of this virus. What does that mean?
Well, when you sequence the genome of a virus, what you have is like you've properly identified this thing. You know its identity very well. So you are now able to start looking for vaccines.
Okay.
Vaccine development is enabled properly. Also treatment options become properly enabled. And sometimes it's also good, it helps you in your tracking of the epidemiology. That is, how is this thing moving all over the place?
And supposedly Nigeria was the first to do this?
In Africa.
In Africa?
Yes.
But that's big, that's huge.
That's huge. That shows the capacity we have. Years gone by, it used to be that when you have outbreaks such as this, we can't even diagnose them.
Wow.
We'll send samples outside the country. But now not only are we diagnosing, we're doing genome sequencing, and that's notable.
Well, congratulations to all the health experts in Nigeria, you know, for showing the world this. Does this sequencing, does it indicate how long the virus can live, the lifespan of the virus?
Well, it gives you a few more ideas about what this is and the characteristics, what would work, what wouldn't work. So yes, you are getting to the place where you can actually characterize, or what would I use, where you can actually say, yes, these are the characteristics of this virus. Mind you, again, a lot of the things that are flying around, well, I think information is getting better. But at the very beginning, people kept posting all sorts of things. Now people are posting all sorts of things by supposed scientists in China who are now telling us about it. But we need to be careful with those things, okay. Partly because this is called a novel or a new coronavirus. New means people don't know.
Yes.
It means that you use old information about coronaviruses and other viruses, but this is new. Who says it's a cousin of something, but who says that it has to be exactly like that one?
Okay, now, following the example of China could be a bit difficult.
Absolutely.
I don't see every country shutting down. So if it's not June, what might it be? Or should I say, what can we take from China that we feel we can actually implement worldwide?
Well, what you can take is that if you are drastic enough, you can stop it in its tracks, yes. But there are many things that go with that, and there are many challenges that come with that. We must remember that China is not the same kind of country as most countries are.
Definitely not.
You find it very difficult to shut down.
Shutting down means you deliver food to people's doors.
Yes.
It means you restrict movement of, you know, a few groups of people catering to other people in their neighborhood.
Absolutely.
And that could be tough.
Really difficult. Just barely shutting down the borders by the US against Europe caused a lot of diplomatic issues. You know, there'll be a lot of internal fireworks also. People who are relatives, who are friends, who have this, you know, there'll be a lot of backfiring. So that's a difficult, complex thing to do, not to talk about your economy in itself. It means you grind your economy to a halt. Economy
to a halt, sports to a halt.
Everything to a halt.
Everything to a halt.
So that really gets to people.
School to a halt.
Yes, that's difficult. But that's like just jumping in front of the virus and say, you know what, first we'll kill this thing, and then we'll deal with all the
everything else that comes
the collateral damage later.
What are your thoughts on what more we can do to keep ourselves safe in Nigeria? Because we still have to, according to you, we still have to be on the lookout, even if we have no cases.
Right. Well, surveillance. Our surveillance has to be very good. I think the one thing that has happened for us is that when you hear about something and it's far away, it's easy to take it easy and just keep saying, well, we hope it won't get here. We're preparing for it. But it will be a different kind of preparation. So I think the index case happening, I think, was good also because it put us on our toes.
Yes.
Now, I think that being a warning shot should help us to not just be looking in places like Lagos or Abuja. We should now start looking at everywhere else. How do we prepare? How do we strengthen our surveillance? How do we train teams in each state that are ready for contact tracing and monitoring and even for treatment? Those are things we need to be prepared for. For instance, a case has been made, for instance, for many countries to look at what happened in China. China is a good case study in many regards, including the clinical management of the cases.
Okay.
Because it is a new virus. So they had to be learning on their feet.
On the spot, yes.
And you have to start talking to them to say and start reading what they publish.
Yes, they have
through
published
official
something.
journals and official channels. That what exactly did you do? What were you dealing with? What did the patients go through? What complications came on board? And what did you need to give them? What seemed to work?
Speaking of which, some publications are coming out now about after effects of COVID-19. People who have survived COVID-19, they seem to be passing through some things. I read of, some lung implications. I don't know if you have any other.
Well, I've seen a few things, but honestly, I think that is still for later. I think the battle is raging at the moment. So at the war front at the moment, you don't worry about the man who loses his limb. How will he live afterwards?
Okay.
You worry about him being alive first. We're still shooting. We're still at the battlefront. So I think at the moment it's okay. They can say they're over it and they should publish everything they can. But I think at the moment, most countries need to learn how to go through.
Okay.
Because they're just still going through or about to go through. And I think that's what we should pay attention to a lot more.
The United Kingdom is talking about attacking this from a different angle, using a different approach. They're talking about flattening the curve, whatever curve that is, so that their health systems are not overwhelmed. What does that mean?
Okay, what's been happening and what China, what the US is trying to do, what Italy has been trying to do, even with the drive-through
testing, yes.
Yes, is that they're trying to find every single case, okay, and try to treat every case, or as many cases as they can, get them all in, diagnose, yes, you do have coronavirus, get in, and we'll treat you, and then we try to find your contacts, we try to test them, if they also have it, we move them in, we try to treat them. And I think the UK is trying to say, hey, we looked at that, except in a situation where you just shut down, like in China, but if you look at the other places, it looks like it did not work well.
Yes, cases are going up in Italy.
Yes, they're saying it looked like it didn't work well. And part of that perhaps could be that indeed the health system, the hospitals got overwhelmed. You had too many cases to deal with.
Because they decided to check everybody.
Yes, because you're dealing with everybody. And then you start prioritizing. There are very, strange feedbacks coming sometimes from there, traumatizing feedbacks. That you have to decide who to face, who not to face.
That's correct.
And all of that. So they are saying, you know what, if people can, remember most people would have a mild illness or even be asymptomatic.
They say 80% of them.
Yeah, so they are saying, why are we using up the resources, even in testing and all of that, to try to find all the people who are not sick or who are not that sick, that we want to try letting those ones isolate themselves, letting them stay home and get well. And let only the person who is very sick be moved in. And then we will be able to deal with those ones and deal with them well. And ultimately, everybody getting, all the other people getting it, will provide us some kind of immunity as a whole. The question is the same application when you deal with things like polio. When you go around immunizing, you don't always get every single child immunized. But when you achieve a certain percentage of the children in that community immunized, that immunity would give that
cover the rest of the community. We need to come back and
immunity.
continue this discussion. We're going on a break now. Let's go on a short break. Meet us on the other side. Welcome back. It's Health Matters, and we're talking about the COVID-19 pandemic. Now, if you want to ask questions, you can call 0805-468-3514. That's 0805-468-3514. You can also tweet at CTV_Mary A, and your questions could be taken on the show. We were talking about the UK strategy. Right. They are going to ask people with symptoms to isolate. Right. And maybe for a week or so. But who's to say that that's going to build their immunity? Are we sure of this?
Well, a good point to make is that being again, new coronavirus outbreak or pandemic, we're not sure of many things. So what has happened is that they've looked at other situations. You look at the China model, you say it's seemingly too difficult to achieve. There are many side issues that the democracy or democratic system
will
perhaps will not allow easily, like China can do. You look at a case like Italy, and you say, well, we see this other method, and it looks like it can get readily out of hand also. In particular, for instance, one of the things that it's noteworthy is the number of deaths for Italy.
Okay.
You know, so you look at the number of deaths in other places, and for Italy, it's a bit worrisome. Mm-hmm. And that's what they are looking at, that it's because they got overwhelmed, you know, in the health system.
So in other words, if you're going somewhere and you're not getting to your destination, change direction.
Yes, and that if you say everybody should go in, but then you don't have enough facilities and personnel to deal with everybody coming in, then you have a new problem. You will get results that you shouldn't get. So why don't you keep the simple cases away, which is most of them.
Which is most of them.
Yes,
about
keep
88%.
Yes, keep them away from the hospital. Let them stay away from there, because let them self-isolate so they don't transmit. But hopefully they are building their immunity. And then the immunity in the community will be enough for the herd immunity, so-called herd immunity, which means that you can break the transmission.
Okay, let me jump in there. We are getting a call from Ogun State. Hello, that's Peter. Hello, Peter.
Hello.
What's your question, Peter? Welcome to the show.
Hello, good afternoon.
Hello.
Hello, good afternoon.
Good afternoon. What's your question? We can hear you.
My question is, what can we do so that somebody will be safe away from this disease?
We didn't get that. Hello? We've lost that.
So what can we do so we can be safe?
Okay. All right. So Peter is saying, what can we do so that we can be free from this disease? Really simple, but fundamental.
Yeah, I mean, the same things. If we means you and I, then we should indeed follow the things that we've been told. Regular hand washing, don't cough, into the open. Cough into your elbows, and ensure that you keep a safe distance from people, especially if they are sneezing or coughing.
Greet from afar.
Well, greet from afar. We're actually not deep down, but again, we do all of those things. If we get used to them now, if we were to have a bigger situation, we would be fine.
How about wiping down surfaces? That's something we don't do. You know, when people sneeze or cough, some of these droplets can touch your surfaces, like your computer, your table, maybe your kitchen surface or something. Yeah. What do we do for those?
Well, I won't say don't do them, because they are good hygienic practices. But in terms of the outbreak at the moment, we are not at the place where those things happen. If you look at some of the other countries where you have what you call a community transmission. Community transmission means people are picking it up anywhere, you don't know where they're picking up from. So they may be picking up from surfaces, they touch the rails somewhere and all that, and they pick it up. And so you find people spraying the community.
Yes.
You find them wiping down.
That's
in
what
buses,
they did in China.
wiping down. Yeah, it's because
but
they
in
have
your
a community
office, in your house, they're not going to come to your office, they're not going to come to your house.
Yes, so that's why I said I mean, you wouldn't say that's a bad practice. It's like even if I had a common cold and I'm sneezing on the surface, it's good practice if I could wipe it off. Because again, somebody else can pick my common cold. And sometimes you have somebody who had a common cold and you got the common cold, you know, and you say, oh, you gave me the common cold, but you really can't tell how you gave you the common cold.
That's correct.
You know, so this is good practice, basically. That's what I'm saying.
Okay, let's keep looking at Italy and the UK. The UK is saying, for example, from what you're explaining, that maybe those people they're going to admit are those with respiratory symptoms, right? Which is just 20% of the time.
Right.
Thank God for that. And it's likely that the other 88% who they keep at home will get well.
Yes.
And then they will have some sort of immunity.
Yes.
We're getting a call now. We'll continue later. Hello. Hello, Godwin. Can you hear us? What's your question?
I can't hear you. I have a question. Can I go ahead?
Ahead, please.
Can I go ahead? I have a question.
Yes, go ahead.
Okay, my name is Godwin. Please, the question I want to ask then, you know, during Ebola, they said after the Ebola, if you survive the Ebola, you develop antibodies against reinfection. For this particular COVID-19, is the same? Does the same thing apply after you survive COVID-19?
Thank you very much, Godwin. You know, I read something, I don't know how true it is, about people who had COVID-19, symptoms left, they got cured, as it were, and then they came back with reinfections. Did you hear of such a thing?
Yeah, I've heard of them, I've read of them. But again, that's why it's important to point out that when something is new, you can observe. Scientifically speaking, what you want is good scientific evidence.
Okay.
What we don't have right now is enough of that for some of those things because it takes time, you know, for you to study them. China has some advantage now, and it's beginning to publish certain things, you know, but there are certain things that it will take time for us to know for sure. There'll be some observations, you know, which people also are
they have
reporting.
To look at the number of people.
Yes, you have to look at the number of people
to immunity.
Exactly, to say some of those things for a fact, you know. So there are many things that people report quickly, and they are reporting them. Some, scientifically reported.
Okay.
They are published in scientific journals. But some of those things also, there'll be further studies.
Let's quickly take Kunle. Hello, Kunle.
Good afternoon.
Good afternoon.
Hello.
What's your question, Kunle?
Can you hear me? Okay, good. I have a tip.
You seem to be cracking.
Okay. Let me change my position. I have an imminent...
So you have to ask the question again.
I have an imminent trip to the UK, and I'm wondering how I can protect myself from infection, whether from the flight or from London itself. Did you get my question?
You're coming in from the UK and wondering how to protect yourself, if I got that right.
Imminently traveling to the UK.
A trip to the UK.
Okay, planning a trip to the UK.
Right.
Okay, let's give that to you.
Well, he has to be careful, do the same things that we hear. Be careful about surfaces, touching surfaces unnecessarily. Be careful about who you hang out with. Be careful about social distancing. Be careful to regularly wash your hands. And where you can't get to soap and water, you have your sanitizer with you. You know, and once you watch what you do and where you go and what you touch, and you wash your hands regularly, and of course, as soon as you don't have to be there, you leave.
And that water that you're washing with has to be running water.
Yes, running water.
Thank you very much for coming to the show. It's been a pleasure.
Thank you. Can I just...
Thank you for being with us. All of you who called, thank you so much. Godwin, Kunle, and I forget the other person. Thanks. Peter, yes. Thanks for calling, and thank you for tuning in. Have a wonderful day, and stay safe. I am Mary Alale Yusuf.